losing a lot of blood that's more than 80 mils during your menstrual cycle? Or is it heavy, as you may know it? Is it clotting, that you have to change your pads or tampons every hour? Do you have to get up in the night to go and change very often? Or do you have to have extra clothing or protection on your bed before you go to bed so you don't flood the area? These are all not normal. So what is normal menstrual flow? On an average, the expectation is that you lose about 60 mils of blood in the menstrual cycle every month. And the cycles can vary between 5 to 7 days maximum. And usually it happens every 28 to 30 day cycles, sometimes 32. But it's important that you track your cycle. But if you're struggling with anything that we've just mentioned before, then you would be diagnosed with what we call as heavy menstrual bleeding. So if this is something that you're experiencing, please go visit your own health professional, or you can visit us as www.athenawomensclinic.com.au to make an appointment to see us. So what exactly could be the causes for the symptoms that you're experiencing? So there could be hormonal and non-hormonal causes. So that can be determined only after investigation. So the basic investigations would be some blood tests to check on your iron levels, your vitamin, your thyroid, your female reproductive hormones. And then there will definitely be an ultrasound that would be required to check on the morphology of the womb itself, and of course the associated organs like the ovaries. So what are the options that may help in treatment? First things first, you have to correct if there is anemia. So if there is low iron, please make sure you get yourself treated for that. Sometimes we can prescribe the contraceptive pills as a hormonal method to help control the bleeding. Please be aware that this is a form of treatment, not necessarily used only for birth control. There are other non-hormonal treatments like tranexamic acid and mefenamic acid that can also be used during the cycles to bring down the amount of blood loss. If that works for you, that's great. If it doesn't, then there are other options. What are some of the other causes that may cause this? Sometimes fibroids or polyps may be one of the reasons why you have such a symptom. That's why the ultrasound becomes very important. If you do end up having something like this, then visiting the gynecologist, they will help us with diagnosing either with a hysteroscopy, or if a surgery is needed, that can be performed at the same time. So this is an overview of what may happen if there is heavy menstrual bleeding. But also, as I mentioned earlier, the contraceptive pill may be used, or other methods of contraception may be used in a general practice setting to help control the bleeding. But again, please use this in consultation with your own healthcare provider and get yourself treated appropriately. Thank you.